Welcome. Good evening and good day, everybody. Hope everybody's day is going well. The summer's going well. It's a nice day out today.
Beautiful.
My name's Tom Spitaleri. I'm the board president here. And we're going to be talking healthcare today. This is part of a series to help you people at home understand what's going on in the healthcare industry. So let's start. We have some questions. Ooh, fun. So what are the Medicare plans for what? Oh, let's actually, for what does Medicare typically cover too? So let's start with that.
First of all, I'd like to say thank you, Tom, for having me here to talk about Medicare and Medicare plans. My name's Heather Hurd. I work at Blue Cross and Blue Shield of Massachusetts. I'm on what's called the senior or the field outreach team, and we're Medicare specialists. But to your question, who are Medicare plans for and what does Medicare typically cover? So Medicare is federal health coverage for people age 65 and older. Sometimes people have Medicare at a younger age because they have been covered for a disability for 2 years. So it's people over 65, people who've been disabled for 2 years. And Medicare is federal health insurance. It provides people with core benefits, medical and hospital benefits.
So it helps a lot of people.
Yeah, I don't know the number now, but probably 55 or 60 million people in the country are on Medicare today.
Wow. So that's a good number there. Now, so you do the outreach, so you meet a lot of people, I'm assuming.
We
you
do.
go to a lot of different places. So probably one of the most common questions is, do you have to enroll in Medicare?
So people usually enroll in Medicare when they reach age 65, and they become entitled to it because as we're working, we pay Medicare taxes through payroll, and we're paying so that we can have this federal health coverage in retirement. So do you have to enroll? I don't believe you have to, but most people would want to because that's the health coverage that's available to them after retirement.
And you've been paying for it. Everybody
You've been paying for it, yeah.
So you might as well. Now, this question's probably asked to you all the time. It's not on the list, but
Oh, okay.
it's an important question because people say this all the time, and I don't believe there's going to be any major issues with Medicare, but people do have a concern down the road, especially the younger people, even younger than me. Do you foresee Medicare going away for financial reasons, or you think it's going to be around?
Oh, I wish I had a crystal ball. I don't know how to answer that question. Medicare has been around since 1965. It was passed by Congress back in 1965. The first person on Medicare was a member as of January 1, 1966. So Medicare has been around almost 50 years now. I hear a lot on TV when I'm watching the news about, Medicare coverage maybe going away. I don't see that happening. The people on Medicare are the biggest voting bloc in our country. And, Medicare is health insurance that they need in retirement.
Right. No, I just wanted to clear that question up because that's a big question for a lot of people
Agreed.
In this system. I mean, I don't ever see it going anywhere. I really don't. It is federally funded, as you said.
And if anything, the changes that have come to Medicare, I would say in the last 10 to 15 years, have been additions to Medicare benefits. The Affordable Care Act of 2012 added in some preventive coverage at 100% that didn't exist before 2012. So I see Medicare benefits becoming more enriched, not reduced.
Right, and that's what I tell people all the time because there's been great strides made in healthcare in the last 20 years. I mean, we've always had the best healthcare, in my opinion, but in the last 20 years, it's made it more affordable for everybody to get it, even balance, and even just recently with the last vote we took, now they cover more with your teeth. You know, I mean, that was a vote taken. It is covered by the, you know, Massachusetts voters voted, and we voted that way.
Yes.
So I don't see healthcare diminishing. I see more and more things being added as the years go on, because they find ways to figure out, okay, we did this, now how are we going to fund the next thing to help people out, and the next thing. It's steps. It can't be, you can't start up here,
Right.
because then you may have issues down the road. But if you go on a step-up plan,
Incrementally.
then you can fund better programs for our older people and even our younger people. And like you said, the people who were disabled for 2 years for whatever reason, via a bad accident, via a stroke, heart attack.
Right.
I mean, we're young, but that doesn't stop anybody from having a heart attack, or there's no age limit on heart attacks or strokes or any of that stuff. So it's always good to have this other system in place. All right, so why and how is it important? Why is now an important time to know about the Medicare plans?
I think it's always important, if you're approaching Medicare eligibility to know about Medicare and the plans. Before I answered the why is now the important time, I think it would be helpful for me to give a little summary about Medicare for people who don't know a lot about Medicare. So I said Medicare is federal coverage for everybody in the United States. Original Medicare, which was enacted in '65, is made of Parts A and B. So Part A of Medicare pays for inpatient coverage. So you can think of hospital room and board. It's free for most people who have paid, you know, Medicare taxes for 10 years or 40 quarters. Medicare Part B, so A and B is original Medicare. A is free, inpatient. B is covering you for doctor care and outpatient services. So if you think about what we do most often, doctor visits, labs, physical therapy, you know, those outpatient services, that's covered by Medicare Part B. And Part B is not free. Everyone on Medicare as an individual, Medicare's individual coverage, pays a monthly Part B premium, and they pay it to Medicare. And Medicare sets that cost, and this year Part B's premium is $164.90 for most people in the country. So $164.90 is the monthly Part B cost. So people go on to Medicare at some point, maybe when you're turning 65, and you get that original Medicare coverage, and you're going to pay the Part B premium. And then you have those core Medicare benefits. So Medicare was never meant to be 100% coverage. Some people think, oh, once I have Medicare, I've got Medicare, I'm all set. It is an option to have Medicare alone, but it's not covering you 100%. There are deductibles for hospitalization and outpatient services, and outpatient services also have a 20% cost sharing after a calendar year deductible. So most people buy other Medicare plans. Private insurance companies sell them, and where we live, usually the plans are supplements that people buy or Medicare Advantage plans. And the way people get prescriptions covered under Medicare is to have what are called Part D benefits. So your question was, why is it important now to learn about Medicare plans? The reason is that, well, first of all, if you're already on Medicare, you have an enrollment period this fall where you can change your plans. Every year there's an open enrollment under Medicare. It starts October 15th. It runs through December 7th for a January 1 change date of your plan. So if you're interested in changing your plans now in the summer, this is a good time to start maybe doing some homework, asking your friends, what kind of plan do they have? Do they like their plan? Looking on Medicare's website, attending perhaps seminars. The insurance companies like Blue Cross and Blue Shield of Massachusetts, where I work, we have online Zoom seminars, but also in-person hotel seminars. The other insurance companies do as well. You can learn about the different plans. So if you do it before the open enrollment time period comes, then you've kind of thought about it before it's time to really take action.
And once you thought about, then come the open enrollment period, you're going to get through the enrollment period a lot quicker.
With less stress.
A lot less stress because you've already figured it out. The other important thing is obviously people's doctors. When you do open enrollment, you want to make sure your doctor is covered. If you like your doctor, which most people do.
Correct.
You want to make sure your doctor's covered.
Right.
And that's the important thing.
Right. So the different types of plans, I'm just going to give a little summary of those.
Yes.
Because people can find it confusing. What's a supplement? What's a Medicare Advantage plan? Well, basically your starting point is to have Medicare, and that's from the federal government. But if you buy a supplement, you're buying a plan that is secondary coverage to Medicare. It's just picking up Medicare balances. And there's usually no co-payments with supplements, and you can see any Medicare provider. So some people like that for ease of use. But supplements can be on the expensive side, depending what you buy. The premiums would range between about $115 and about $230 per person per month on top of that Part B premium that you're paying to Medicare. And you still don't have drug coverage, so you have to buy your own Part D prescription drug plan. And there are many of those in the market. A Medicare Advantage plan is another option, and these are being very heavily promoted. So there's a lot of TV commercials advertising Medicare Advantage, and sometimes they use actors. You'll see them on TV like William Shatner and Joe Namath, and they're talking about zero premium and zero co-pays. They're talking about Medicare Advantage plans. These are usually HMO and PPO plans. And when you buy a Medicare Advantage plan, you still pay that Part B premium to Medicare, but now you pay just a premium for your Advantage plan that usually includes drug coverage and a lot of extra benefits. And the premiums are usually lower. In fact, there are zero premium plans in the market. Now, what people have to be aware of with an Advantage plan is the cost sharing, because you pay as you use services. So you'll have things like co-payments, hospital cost sharing. But that's really the way people go. They have Medicare and they go down the path of buying a supplement and a Part D plan, or they buy a Medicare Advantage plan. And this is when in the open enrollment period every fall you can change what you're doing.
Right, and helps you out and gets your prescriptions and everything in order. So that's a lot of good information you've given out so far today.
Thank you. And the plans can change a little bit every year. So that is a piece of advice I would give people. If you're on a Medicare plan, you'll get a letter from your plan sometime around October 1st, and it's telling you as a member how your plan is changing, if it is, and you can decide that change is okay for me. You don't have to do anything. Or if you don't like the changes, now you have the open enrollment period to switch your plan. And there are a lot of resources there to help you with these decisions.
Yeah, that's actually good bits of information, especially if your doctor's no longer in the plan, and sometimes that does happen.
That does happen.
And I know this happened to people before, but when you get that letter, probably your best bet is to call all your doctors to make sure that you're still covered, because they would have all that information already. Save you a headache.
Well, you might not have to do that, because if you have a Medicare plan and with a doctor, if they are not going to take the plan, they have to write to you under Medicare guidelines.
Oh, okay.
And
so
tell
that's a
you,
little
so
bit
you shouldn't have to do that legwork.
That's good. That's good. That's good information to have.
Mm-hmm.
Because sometimes those plans do change. The doctors change, and
yes,
for whatever reason. All right. So the annual enrollment period is October
15th to December 7th for a January 1 coverage date.
So it gives you some time, but not a lot of time. So it's best bet, people listening at home today, do your homework now.
Yeah, or you can
Start
start slowly, but it's not a bad time to learn about different plans if you want to make a change. If you're new to Medicare, you're not yet on Medicare, let's say you're listening now and you're 64, and you're thinking, well, Medicare's next year, how soon should I start learning? I would say a good period of time is about 6 months. Give yourself about 6 months to learn about Medicare and learn about Medicare plans. And there are resources for people, and you have some great ones right here in Lawrence. So do I have time to tell you about that?
We've got plenty of time, yeah.
Okay.
Because that's what we want to make sure people in the Lawrence area, and this is also shown in other communities, will bicycle it. So
Okay.
they can at least know where they can go to find this great information out, so they're not struggling through the computer, because some people don't do well with computers.
Right. So as I said, health plans like Blue Cross and Blue Shield of Massachusetts, we have webinars and in-person seminars, both educational and sales meetings to tell people about our plans.
And how can they find out where Blue Cross is having that local hotel chat?
On our website, if someone looked up bluecrossma.org and you click on Medicare, you could see a list of our webinars on Zoom and our seminars. But a resource that's really helpful for people in Massachusetts is called the SHINE program. And SHINE is an acronym. It stands for Serving Health Information Needs of Everyone on Medicare. And so most senior centers in your communities have SHINE counselors, and they have office hours, and that's a free service to people who are trying to understand Medicare and the various plans. And they'll also help you with the enrollment timeframes, because there are late enrollment penalties if you don't sign up for Part B at the right time or a Part D drug plan at the right time. So SHINE could help you understand that. Also, here in Lawrence, you have Age Span on Merrimack Street, which formerly was called the Elder Services of Merrimack Valley. There are SHINE counselors there as well. And I know that I'm almost 100% certain that there are SHINE counselors who speak Spanish and other languages, but they would have access to interpreters. So SHINE is a wonderful program if you're learning about Medicare and the plans and you find the process overwhelming. Sit down with a SHINE counselor. It doesn't cost anything, and they'll help you. They'll ask you who your doctors are, what prescriptions you take, and they'll help guide you to picking the right plans.
That's a lot of great information that's going out today.
Yeah.
So remember, folks, go down to SHINE if you need that help, because they're there to help you out. That's the most important thing.
That's what they're there for. SHINE is a wonderful program.
All right. So what are some of what's new to this year's Medicare plans? Every year they put new things in
Something
place.
that was new this year, starting in January 1 of 2023, was a limit on the cost of insulins. And this came about from last fall. Congress passed a law called the Inflation Reduction Act. And in that law, it addressed the rising cost of insulin. Over 3 million people on Medicare in the United States are diabetics who use insulin, and it's expensive, and some people were finding it very difficult to pay for their medication. So the Inflation Reduction Act limited the cost of insulins to $35 copays, and that took effect on January 1 of 2023. So no matter what Medicare plan, Part D is prescription drug coverage when you're on Medicare. You buy a Part D plan from a private insurance company, and there are coverage levels for your prescriptions. But now, because of that law that was passed, and this is new in 2023, no matter what coverage level you're in, your insulins are never going to be more than $35 copays. So that was one new thing this year.
That's excellent news for a lot of people.
Yes.
A lot of people. Anything else new happened this year?
Well, nothing was taken away.
That's good.
And I think Medicare Advantage plans are being marketed a lot more, so that's why I mentioned the TV commercials. There's a real push for people to consider Medicare Advantage plans. So let me just talk about those for a moment. If you're interested in a Medicare Advantage plan, these can work very well for a lot of people. There's a real range of premiums, but they're pretty cost effective. And as I said, you can find a Medicare Advantage plan, quite a few in our market, that are zero premium. So you're paying your Part B premium to Medicare, But then if you enroll in a Medicare Advantage plan and you choose one with a 0 premium, you're not paying anything. You have Medicare A and B benefits. You never give up your Medicare benefits. You have usually extra benefits. So the Advantage plans, I guess something that would be new is a push on these extra benefits that people like. And they all tend to be preventive. So routine vision, routine hearing, money towards glasses, hearing aids, money towards fitness, over-the-counter benefits, preventive dental. Medicare doesn't cover dental services. So if you have an Advantage plan that has preventive dental, you might have 2 or 3 cleanings a year covered in your Medicare Advantage plan. Part D drug coverage included in that plan. So a lot of benefits, but what you need to be mindful of with an Advantage plan is how much you pay as you use services, because you do pay as you go. And that, you want to know how much are the co-pays, the hospital cost sharing. That can add up to what Medicare calls an out-of-pocket maximum. And this is usually in the $3,000 to $7,000 range, depending on the plan that you choose. Now, if that's for people who don't like that unknown of, well, my premium's 0, but I don't know how many services I'm going to have, so some people don't like the unknown. A more predictable route to go is to buy a supplement. To buy a Medicare supplement and a separate prescription drug plan. The supplement's premiums are higher, but you have less out-of-pocket cost. Not quite as many extras.
No, but the supplemental plans, for a lot of people, health clubs, fitness clubs, that's still big, especially in the younger retirement generation.
Yes.
I have a friend that's, let's put it this way, in his late 80s. He still goes to the gym every day, and he still walks in Haverhill, and Haverhill's known for hills.
Yes.
He walks the tallest hills in Haverhill every day. In fact, if I went there this morning to go where I usually go in the morning, I would probably see him walking, and it's almost 90 degrees out.
Wow.
He doesn't stop walking. He walks every day.
Wonderful.
So he
Good
keeps
for
himself
him.
in great shape. So a lot of older people are now looking into the
Yes.
fitness, and where they weren't in my grandmother's generation was a little different than today's grandparents' generation.
Yes. A lot of supplements give fitness benefits. It's usually like $150 or $200 a year. People can use that towards their gym memberships if they have them. Some of the Advantage plans, most of them give gym fitness as well. Weight loss benefits, so if someone's doing Weight Watchers or a hospital-run program. And oftentimes you can use that fitness benefit not just on a gym membership, but if you're a swimmer and you go to a pool or exercise classes, including at your local senior center. You have a wonderful senior center here at your Council on Aging.
They have a great exercise program and stuff that goes on over there.
Yes.
They have yoga there. I've seen that and a few other things.
Yes, shout out to Martha Velez, who runs a really wonderful Council on Aging and Senior Center in Lawrence. But a lot of times the fitness benefits will reimburse people on costs towards exercise classes at their senior center.
Which is a good thing.
Totally. Move it, keep moving. I say movement is medicine.
Any new stuff coming up for the 2024?
Well, that's a great question, because if people hear this and they think, oh good, I want to know what plans are available in 2024, it's tricky because Medicare does not allow plans to release plan information until October 1st.
Oh, okay.
So you can learn, generally speaking, about the supplements and the Advantage plans and which plans your doctors take. And I think the companies that sell plans, like Blue Cross and Blue Shield of Massachusetts, we don't make wild changes to our plans, or we try not to. There are occasionally changes to premiums and benefits, and we like to add things when we can.
Right.
So you'll get a general sense, but you won't know the exact plans available until October 1. That's when you can call the insurance companies. That's when you can go on the websites and see the new plan information, and all the seminars and webinars will be talking about the 2024 plans after October 1.
Got it. So that's good information to know too for people. So the homework they do over the summer, there may be a little bit more tweaking of that homework come October 1st.
Yes, they'll get comfortable with the terminology and comfortable with the types of plans available, but they won't have the exact information.
Right. But if you get comfortable with all of that, getting the exact information is going to be a lot easier than waiting till October 1st and trying to do it all at once.
Right. It's also easier to see a Shine counselor before October 1st. The Shine counselors become very busy once the new plan information is released, and all the people are concerned about what changes they need to make.
Right. So instead of you go now, you learn a little bit about things. They may not be 100% the same, but they're probably 99 or a little bit better percent.
Right. You'll have an idea of what
Right.
you're going to do.
And how you're going to do it. The numbers may change a little bit for you, but they're not going to go in big increments. They're more like that.
Right.
Well, that's all good news. I hope people are listening at home and taking this in. One of the last questions we got here, what is the best piece of advice you can give individuals who are facing Medicare decisions?
Well, we kind of talked about it, but
Yeah.
I guess I'll just emphasize it. Don't wait. If you're new to Medicare, you're just turning 65, give yourself plenty of time to learn about Medicare and the plans. I would say 6 months is a good time frame. If you wait until a few weeks or a month before you're going on to Medicare and you need to pick a plan, that can be a stressful situation. You can sign up for Medicare. Oh, the way to sign up, I didn't talk about this, is through Social Security. That's how you sign up for Medicare. And the first time you can sign up for Medicare is in what's called your initial election period. So let's say you're turning 65, your Medicare will start on the first day of the month of your 65th birthday, and 3 months before that birthday month, you can go to Social Security in person, online, or by phone, and say, I want to enroll onto Medicare. And once you do that, then you can now start researching the various plans. So give yourself some time so it doesn't become a pressurized situation. And if you're already on Medicare and you know that you want to make a plan change in the fall, as we talked about, start doing a little research now so that you're prepared for October 15th. You do have through December 7th. So if you want to go to some of those seminars or webinars that the insurance companies offer, those will be available on the websites as of October 1. You can pick one and go and learn about their different plans.
Yeah, those are always interesting to go to. I've been to a few different seminars like that, and they're always fun to go to, meet people, talk
Have a
to
cup of
people.
coffee.
Have a cup of coffee. Sometimes they have cakes out there and stuff too.
Yes.
So if people want to know about the Blue Cross and Blue Shield, they go to what site?
Our website is www.bluecrossma.org, and then it brings up our homepage, and at the top it'll say Medicare. You'll click there, and then you'll see all of our plan information. We have tutorials and little videos you can watch to learn, to educate yourself on Medicare, and also our seminars and our Zoom webinars are listed there. So there's a lot of information for you.
And the good news about those Zoom webinars is if you're working all day, you can watch them at night. You don't have to be on during the daytime.
That's right.
Well, we've come to an end of a great show. We're probably going to have you back on because there's a lot of great information
thanks,
today.
Tom.
I want to thank you and
Thank
Blue
you.
Cross for coming on today. I want to thank you guys for tuning in at home today. And we'll be back soon with a different type of education seminar for you, for the people of Lawrence. Thank you very much and have a great day.
Thank you for having me.
No problem. Thank you.